I'm a sucker for statistics. Show me a good survey, a good report, and I'll be first in line to dive into the numbers. Every year, Klein Partners puts out a survey with the latest consumer insights in healthcare. It's a report that I love to read. We reached out to Klein Partners to ask them to come on camera to discuss their latest interesting findings for 2023. Hello and welcome to Swaay.Health, where we explore the latest trends and interesting stories from the brightest minds in healthcare marketing. I'm Colin Hung, and joining me today on the program is Rob Klein, founder and CEO of Klein Partners. I caught up with Rob at his booth at the SHSMD23 Conference in Chicago. So, get ready to be inspired, learn some new tricks, and take your marketing game to the next level. Let's jump right in. Rob, welcome back to the program.
Thanks, Colin. It's so good to be with you again.
It's always fun to get together with you in person. You've always got some exciting things to tell us about. Talk to me about your latest report.
Absolutely. Well, we're going to do a quick hits this time. So we just finished our National Consumer Insight Study where we talked to 1,000 consumers nationally. So I've got the results of that, but I wanted just to share some of the top line findings with you. So I thought I'd kind of hit you with a few things. Are you ready?
Hit me, Rob. Hit me.
Alrighty. So the one thing we're learning is that COVID brain is still with us. And remember last time we talked about COVID brain is that it's affecting people's memories, attention span, their patience, unfortunately, and their brand linkage, meaning understanding when they see an ad who that was. So that has not changed. It's impacting about 1/3 of Americans are suffering from what I'm calling COVID brain. Not the clinical, but just our CPUs are overheated because there's so much going on. Now you throw in what's going on with inflation and the economy. We're also finding that people are hurting more financially. So that's adding on to all of the trauma that they've had with COVID. So we're not back yet as a society. So as healthcare marketers, we really need to understand that people are struggling. They're not paying attention. They're not running to the TV or looking at all of our billboard ads. So we have to meet them where they are at mentally now. And that means our advertising has to be simple, catchy, repetitive, and the brand needs to be the star. Don't hide the brand. Make it clear that this is the message and this is who is sending the message, because they're not really paying attention. So that's the first unfortunate aha. We're also noticing that they're more likely to say, my mental health is not where I want it to be. That has not gone back up. So we're seeing that. I think we're facing a mental health crisis in this country. We have to address it as an industry. If we don't, who will? So here's some of the other things that I'm noticing too. So I've got some numbers here I want to share with you. These are hot off the press. That's why I'm looking at the press.
So I love it.
81% of consumers nationally agreed with that they trust their provider to keep their PHI secure, but then 40% also agreed that they're hearing on the news about all the data breaches. So how long before they start thinking, is my information safe? So right now they're kind of watching that it's not happening to me, but that may change as we see more data breaches. So that's something we have to address. And then 73% said, and this is huge, this is the first time I've asked this question, 73% of Americans, that's 3/4, agreed that how a health system treats its employees is the biggest factor in whether they're going to have a good patient experience or not.
Interesting.
Yeah.
Okay.
So, it is interesting, but I go way back to when the Harvard Business Review 30 or 40 years ago did that seminal work with Sears. And they were able to prove quantitatively the connection between how you treat employees and how the customer experience goes. It's with us as well in healthcare. So when you read all that's going on with nurse strikes and how nurses are feeling, I just saw an article where more and more nurses are getting out of nursing because they just can't take it. Nurses are the #1 brand ambassador for a health system. How the nursing experience goes has a huge impact on their experience. So we have got to figure out how to treat our staff better. Otherwise, patient satisfaction is never gonna move.
One
It's only gonna
flows,
erode.
one flows
Absolutely.
into the other, right?
Absolutely. And here's the other thing: 60% of patients said, "I feel like a captive customer," meaning it's so hard to change that I'll put up with what you're doing to me because I don't know how to find another change. So they're staying not because they love the brand, but because there's no choice. But then, conversely, 23% are now saying service has gotten so bad at my PCP's office that I am seriously considering changing doctors.
Wow.
That was 10% 7 years ago. So we have almost 2.5 times increase in frustration with primary care. And a lot of that frustration is coming from access. I know we've heard it with several people talking today at the breakout sessions. Access, if we had to describe healthcare's needs in one word, it's access. Most people, in fact, 60% of Americans said, I'm having trouble getting in for primary care.
Rob, you shared a lot of great information. Before I forget, where can people go to find this report and get more information?
Oh, thank you so much for the plug. So if you just go to www.kleinandpartners.com and go into our Knowledge Center, we will have the full report there that you can download. And please feel free to share it with everybody because there's a lot of stuff in there that I don't even have a chance to talk about today. So this was just kind of a little icebreaker and teaser of what's going on.
I love it, Rob. Thank you so much for being on the program and for sharing this information.
Oh, Colin, so good to see you as always. Thank you.
I want to thank Rob for coming on the program today and talking about his latest consumer insight report. The key takeaway for me is the fact that we still have COVID brain. And as marketers, what that means is that we have to be very direct and very upfront with both our brand and our messaging. We can't make it hard for consumers in this type of environment. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to Swaay.Health. That's Swaay with 2 A's, .health. That's where you'll find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.